Assalamu alaikum, friends. This is 𝗕𝗏𝘀𝗺𝗵 in Chicago, and you are watching my channel, Knowledge for Quality of Life. Friends, I have a first request to make that all these vlogs I'm doing, I'm sure that you must be watching partly or sometimes completely, but spend some time on the topics which I have included in the description. The research papers, the articles which I share. The point I'm trying to make here is vlogs are 15 to 20 minutes or 30 minutes at the most. You will not get the proper grounding and understanding of the material. But this whole vlog I started is to share the knowledge. And my objective here is to update your information or knowledge, what I have gone through over the years. So it's not just that you're going to gain in 15 to 20 minutes video, but if you included description notes and articles, which I have included in the description, and take some time, because it's a process of knowledge gaining. The better you are equipped, it will pay dividends in the long time to come. So this is my request, humble request. I'm sure that you will spend some time to review those articles, and I would also encourage you to give me your feedbacks and comments. I religiously I look at all the comments and try to give the feedback. And I'm not a professional vlogger, and I'm not claiming that my vlogs from the quality perspective is excellent. But the content which I'm sharing here is very practical, and I can vouch for that. And I have tested those content myself in life over the last 30 plus years. And that's why I'm sharing with you here. So let's jump into the next topic. Is today we are going to look into the vitamin D and the relationship with the pregnancy outcome. It's a topic which will impact mother and the newborn babies as well. In a way, it impacts father as well. So remember that when baby is being formed in the uterus, it's the blueprint of the baby is being formed basically. And as we've been talking over the time now that vitamin D, the hormone form, not the vitamin D which we take and generates into the blood, 25-hydroxy. We are talking about the hormone which gets converted after it passes by the kidney and then becomes the hormone. That hormone does magical things in multiple processes at multiple gene level. So whatever the mom's status is going to be in her vitamin D in the blood serum is going to be fed to the baby when baby is in the placenta. And whatever mom's status is going to be, how the baby is going to form baby's blueprint. So all this issue of which we have known that the diseases, it will come into the future life of the babies when they are grown up. It's going to be depicted based on what was the status, how the raw material came to the baby based on the mom's status of vitamin D. Now, when we go to the doctor, normally, pregnant women, there's a lot of emphasis by the OB/GYN doctors on folate and iron, and which is very important. Those are very important nutrients during the pregnancy. And, sometimes they recommend you the prenatal vitamins too. Now, those prenatal vitamins has multiple things in it, but mostly are covered up to 400 to 1,000 IU of vitamin D only. Now, it's not how much you take the IU, which I've been saying in my previous vlogs, is the status which you maintain in the blood level. So that's the most crucial part. And we will share some information here that how things happen and what nature is trying to tell us. So let me share my screen with you. So this is one of the slides which I have shown you before in one of my previous vlog, that researchers went to the East Africa and drew some blood from various tribes. And they have plotted this vitamin D level in the nanomoles and above here in nanograms per milliliter. So if you look at that, female and male both were the part of this study. But if you notice here, the crucial part which I want to illustrate here is that from the same tribe, when the females were non-pregnant, they were making some vitamin D in their blood level through the sunlight, because these African tribes are not taking any supplement. They are outdoor people. They are just using the sun to make their natural need for vitamin D. So if you look at this tribe, 𝗥𝗲𝘀𝗵𝗵, and if you look at this tribe, same, this pink is female, and the yellow one is a pregnant woman from the same tribe. Now see here what's happening, that keep this in mind in the slides for the future slides, which I'm going to show you, that what's happening. So it means that pregnant moms are making more vitamin D because due to the pregnancy status. Now, it means that nature is wiring us in a way that whatever mom's status is going to be not enough for mom only, but it has to feed the babies as well through the placenta. So it means that the whole process, and this magic starts after 12th week of pregnancy, which we will look into that, how it converts into the hormone form, this vitamin D, which we are measuring in our blood, normally 25-hydroxy, which you see here. But actual form which gets converted into the hormone is when it gets processed through the kidney, and that becomes 1,25-dihydroxy, which we say in a form that it is calcitriol, which is the hormone form. So the pregnant women, by nature, by design, it says that it requires more vitamin D because it needs to input all the raw materials for the blueprint formation of the babies. Now, this chart is telling us that, what is the average status in US women. Now, this is age from 18 to 45. This is between 2005 to 2006 study, National Health and Nutrition Examination Survey. This is a database. The population size was 1479. Red is women's status of vitamin D less than 20 nanograms per milliliter. Yellow, orangish is 20 to 39, and green is 40 nanograms per milliliter and above. So if you look at the African American women, they have basically zero above 40 nanograms. Basically, the bulk is here. African American women is less than 20 nanograms per milliliter. That's the natural level. And if you look at in the white category, it is 19, 71, and 10%, which is basically above 40 nanograms per milliliter, which is the highest amongst all the category. Now here, Hispanic community, 59, 39, and 1. And in other mixed communities, including other Asians, 47%, less than 20 nanograms, and then 50%, 20 to 39, and then only merely 3% above 40. Now here, look at this one. Overall, for all the subject studies, only 7% overall have levels recommended for pregnancy. You remember that, we've been talking that a standard optimum range is 40 to 60. Now, this magical number hasn't come, it hasn't arrived with some mystery. There's a logic behind it. There's a science behind it. There's an observation behind it. And the previous slide, which I showed you amongst East African population, that's how the nature has wired us to maintain that status. And they have observed in the swimmers, they have observed in the construction workers, and so on and so forth. People who expose themselves to the sun, what we are wired for. Here, if you look at only 7% of all the study group merely makes it even close to pregnancy requirement, which is 40 nanograms or more. Look at this chart. This is the probability of taking longer than 6 months to even conceive a baby. So if somebody wants to become a pregnant, a female wants to be pregnant, less than 20 nanograms per milliliter, if the person's status is less than 20 nanograms per milliliter, there's a 51% probability that it's going to take longer than 6 months to conceive a baby. Now, if you take that vitamin D status to a 50 nanograms per milliliter, which is within that optimum range, which we've been talking about, 40 to 60, the probability drops to 15%, right? So it increases. So it means that, between 20 to 50, the probability drops 71% lower probability. So it means that the chances of conceiving increases when the probability goes lower. Now, male counterpart should be also concerned about it, because we shouldn't be happy about that, this is only pregnancy is only a female thing, because, if this study shows that, pregnancy rate per patient. So if someone in the male category has less than 30 nanograms per milliliter, they have a pregnancy rate of 9%. But at the same time, if the person takes greater than or equal to 30 nanograms, the pregnancy chances becoming a father increases by 28%. So that's 3 times higher the chance of pregnancy. So this vitamin D is basically, it doesn't impact only mother and the fetus, but to the father as well. Now, this is the chart, what they have done. I will spend some time in explaining this chart, what is happening here. So this is the circulating 25-hydroxy you are seeing here, which they normally test in our blood, which is vitamin D level. And this is, on the y-axis, it is 125-hydroxy, which is the hormone form, which once it gets processed through the kidney, it becomes a hormone. So they have measured throughout the pregnancy, throughout the pregnancy, they have measured a variety of pregnant females, these both numbers, and they have plotted this data, and they try to fit the curve. Now, this curve is exponential curve. If you look at the equation underneath here, that it is an exponential curve. So curve is like this. Now, the curve changes to its point of inflection is around 40. What they have noticed that around 12 weeks of pregnancy, this 25-hydroxy, which is a common vitamin D level, when it converts to the circulating 125-hydroxy, which is the hormone form, which is the main raw material which provides the raw material to the fetus, it increases by 3-folds. It means this is by nature. So it means that beyond 12 weeks, the fetus requires more hormone to be fed in the blueprint formation, so that, but this increases by 3-folds, 3 times. Now, in the normal non-pregnant woman, if this thing were to happen, then this would create a hypercalcemia, means your calcium level will go through the roof. But how nature has wired us, that during this process of this conversion, when mom is pregnant, her calcium doesn't go exceeding level. This is the beauty of the nature, that, how nature controls tightly. And this uncoupling happens only during the pregnancy, around that time. This is amazing to me. When I read this thing, it was an aha moment for me, that, how nature plays so beautifully, that it's so precisely calculated that, what needs to be fed to the babies is done through the mom. Now, question is that whether the mom has that status or not, right? So that's the most important thing. So this is what I would suggest to people who wants to become a pregnant mother and future pregnant mother or existing pregnant females. When you go and see your OB-GYN, read this material very carefully and bring this new research, new knowledge, because whatever this new knowledge we are talking about, it happened over the last 12 to 15 years. And some of the doctors are probably went to school probably earlier than that, and they don't have that much time to be in touch with the current technology and current advancement in all the medical fields. Because I've been speaking to my previous doctor and my current doctor, they don't have that kind of time to read the current knowledge, what is coming up, because each and every field is evolving as we speak. So we have to be at the cutting edge of the current knowledge. And the more we educate ourselves, the more we are equipped with ourselves, we can have a better conversation with our OB-GYN that, hey, this is the hormone, this is the literature which I'm reading, and this is what it is, and guide me around that parameter. So remember that this inflection point happens around 40, means 40 is that magical number which we've been talking about, that 40 to 60. Now, if you look at 40 to 60, there's a very less increase in the slope. Now, people who know a little bit mathematics, that point of inflection is where it changes its slope from concave to convex. So the rate of change of that slope is becoming a zero, and it reverses the curve. Now, if you look at beyond 60, it's pretty much flat. It means that if somebody takes their vitamin D level beyond 60, it's not going to be that useful during the pregnancy state, right? So this is how you read this chart, and it's exponential curve. It's not a straight line. So it means that it rises certainly, and that magic happens after 12 weeks. Now, this another chart is how vitamin D level impacts early pregnancy effect, particularly risk of miscarriage. So if you look at the miscarriage risk here and vitamin D sufficiency, let's say here 30 or higher, we consider is it sufficient. So if we take as a reference as a 1, now if somebody is D deficient, less than 20 nanograms, the risk factor is 1.94. It means that there's a 94% chance of miscarriage if someone's vitamin D is deficient below 20 nanograms. So it's very crucial. It's very, very crucial. So I've been saying this since last November. I've started that, the more I look at it, I've been looking at this hormone for the last 8 years. And every time I look at it, I read something new. It just amazes me that how nature has wired us. Now, this thing is occurrence of cesarean section, preeclampsia, and preterm birth. Now, which we know and commonly call is C-section. It's not a normal delivery. They have to cut the stomach and have the baby delivered. Now, preeclampsia is a state during the pregnancy that when mom experiences very hypertensive, high blood pressure, and sometimes retention of the fluid during the pregnancy or after the pregnancy, and excessive protein in the urine as well. So this is the state of preeclampsia. And then preterm birth, like we know that some babies are born as a preemies. So these are the different color coded here. Red is C-section, orange is preeclampsia, and then blue is preterm birth. So if you look at that, the percentage occurrences happen that in these 3 categories, when someone during the pregnancy had 10 nanograms or milliliter below, 10 nanograms per milliliter or below, the C-section chance, their occurrences was 47%, 27%, and 28%. And preeclampsia is 36%, 14 and 12%. And then if you look at the preterm birth, in the third category, when your high vitamin D level was greater than 20 nanograms per milliliter, the preterm birth was 1%, and then preeclampsia is 2%, and the C-section was 19%. But if you look at difference between this 47% to 19%, there's a drop of 60% reduction in C-section, only if you have kept during the pregnancy of vitamin D level greater than 20 nanograms. Now, for preeclampsia, the drop is 93% reduction. And for preemie babies, the drop is 96% reduction in preterm birth. So now think about it, that how many women's in the United States, and actually I have looked at it, the worldwide data as well. There is no difference. People are vitamin D deficient in the sunny countries like Pakistan, India, all the Asian countries as well, because we have to go in the sun to make some D. And there's a lot of ignorance actually, which we don't know. And there's a lot of lack of education as well, that people don't know that how this vital hormone plays a role in someone's life who hasn't arrived on the planet yet. Now, this chart tells us that maternal outcomes and infant outcomes. So disease risk reduction, pregnancy by vitamin D level. So now 25 is the reference range, because that's the average in the US and Canada. And if you look at, this is the vitamin D level here in nanograms, and this is a maternal outcome for the pregnant woman, and this is the infant outcomes for the children. So if somebody is at 40 nanograms per milliliter, that person has at 37th week, the probability of having a preemie baby reduces by 35%. Okay, so and all these issues are, conditions are listed here: preeclampsia, gestational diabetes. A lot of kids inherit diabetes type 1 based on in the future, based on the status when they were in mom's womb, what the status of the mom was at that time for the vitamin D level. So think of this as that, whatever we are going to do is going to be, repercussions are going to be borne by the newborns. After the newborn is born, and in the future years as well. So, and also, if mom, after the delivery, if mom is lactating, again, I'm telling you that, at that time, whatever mom's status is going to be, it's going to be a transfer to the baby through the mother's milk. So it's very crucial that, during the pregnancy and after the pregnancy, mom needs to maintain that level between 40 to 60. Now, there was a huge study, very long study of almost 25 years long, funded by National Institute of Health at Medical University in South Carolina. And the two lead researchers worked on it, Dr. Carol Wagner and Dr. Bruce Hollis. I included some of the material in my description. Read them. They have observed this pregnancy state. After the pregnancy, they have observed the newborns, and they have tracked the data, and they have huge learning from that study. And that's basically took the stage of a lot of this work, which we are seeing in the scientific literature for the vitamin D, how it plays a role in the pregnancy. Now, for infant outcomes, small for gestational age, low birth weight, common cold, respiratory tract infections, asthma, ADHD-like symptoms, all these impacts the newborns, based on the status of mom's vitamin D level during the pregnancy. So remember that, this is very, very crucial, and to understand this thing, that how critical it is for not only mother, but the newborns who is not yet arrived. And let me stop share this. So please, I have a request that if this vlog, this information doesn't impact you directly, but I bet you that it impacts someone amongst your circles, amongst your loved ones, amongst your relatives, amongst your children, amongst your grandchildren. So share with them as much as possible, because I just want to give you this food for thought that besides folate and iron, there is something that it's very crucial during the state of pregnancy, which is vitamin D and magnesium as well. And I will leave with this thought that remember that this vitamin D is something that it's going to depict not only the people like adults, us, the quality of life, but it will depict the quality of life of the newborn as well in the years to come. See you next time with another important topic.